Hi everyone, welcome to the channel. Please subscribe and come back often to get more no-frills, no-nonsense valuable health information. Most people think anesthesia just puts you to sleep, but there is so much more you need to know to protect yourself during surgery. According to the National Institutes of Health, every day about 60,000 people undergo all types of surgery and other medical procedures with the help of pain-relieving drugs. There is no doubt that anesthesia, whether inhaled as a gas or injected into your bloodstream by a highly trained doctor, has enabled millions of people to receive medical treatments that lead to longer and healthier lives. That said, there are some things about anesthesia that may surprise you. What is anesthesia? Anesthesia refers to the use of medications called anesthetics to keep you from feeling pain during procedures or surgery. At the site of the procedure, to the centers of the brain, anesthesia temporarily blocks sensory signals from your nerves. This keeps you from feeling pain. You have different types of anesthesia that work in different ways. Some anesthetic medications numb certain parts of your body, while other anesthetics numb your brain so you can sleep through the procedure. Depending on your procedure, you can be given one of the following types of anesthesia. Here are the types of anesthesia. You have local anesthesia. This numbs a small section of your body. Doctors use local anesthesia for minimally invasive procedures like cataract surgery or skin biopsy. You're awake during this procedure. Another kind is sedation, also called twilight sleep. Sedation relaxes you to the point where you'll nap, but can wake up if doctors need to communicate with you. This may be used with wisdom teeth removal, cardiac catheterization, and some colonoscopies. Although you won't be completely unconscious, you probably won't remember the procedure. And then you have regional anesthesia. This blocks pain in a larger part of your body, like a limb or everything below your chest. This will be used for an epidural to ease the pain of childbirth or something like an arm block for hand surgery. Sometimes doctors might administer regional anesthesia in addition to sedation, or they may administer it by itself. Then you have general anesthesia. This makes you unconscious and insensitive to pain. Doctors use general anesthesia for more invasive procedures or surgeries of your head, chest, or abdomen. This video focuses on the potential risks and side effects of anesthesia. Here are 15 of these risks. Depending on the anesthesia type and how providers administer it, you may experience back pain or muscle pain, chills caused by low body temperature, hypothermia, difficulty urinating, fatigue, headache, itching, nausea and vomiting, pain, tenderness, redness, or bruising at the injection site, sore throat. More serious risks include memory and learning, long-term memory and learning issues, aesthetic awareness. For unknown reasons, some people experience aesthetic awareness, where you are aware of your surroundings but you can't move or communicate. Collapsed lung. Surgery that uses general anesthesia or a breathing tube can cause a collapsed lung. This condition occurs when air sacs in the lung deflate or fill with fluid. Nerve damage. Some people experience nerve damage that causes temporary or permanent neuropathic pain, numbness, or weakness. Post-operative delirium. Some people ask why they go crazy after having anesthesia. Anesthesia is a drug that can be mood altering, and different people will have different reactions to it. When some people wake up from their sedation, they may experience emotional responses such as being confused, combative, or teary-eyed. Some have memory loss and develop issues with learning. Older people are especially vulnerable. Waking up during surgery. In rare cases, a person can regain awareness of what is happening in the operating room when they should be unconscious. They may be able to hear what is happening around them and possibly even feel the procedure being performed. Such awakenings are usually brief, and patients usually do not feel any pain. Anesthesia awareness can be more common in high-risk patients who have multiple medical conditions, or those who are being treated for an emergency in which the usual dose of anesthesia cannot be safely given. People who are at greater risk when getting anesthesia. Advanced age, very old people, diabetes or kidney disease patients, a family history of malignant hypothermia, and anesthesia allergy, heart disease, stroke, high blood pressure or hypertension, lung disease like asthma or chronic obstructive pulmonary disease, COPD, obesity, body mass index or BMI of 30 or more, seizures or neurological disorders, sleep apnea, smokers. Smokers have irritated airways. As a result, they may need higher doses of pain medication to improve their tolerance with the breathing tubes. People who smoke or ingest marijuana, cannabis, on a daily or weekly basis may need more than twice the usual level of anesthesia for routine procedures. If you know ahead of time that you're going to be undergoing surgery, quitting smoking, even just a few days beforehand, can help reduce your risk of complications and help you heal. Anesthetic drugs can stay in your system for up to 24 hours, but you should call your healthcare provider if you experience difficulty breathing, extreme itching, hives or swelling, numbness or paralysis anywhere in your body, slurred speech, dysphagia, or difficulty swallowing. Although anesthesia is generally safe, any surgical procedure can present a certain degree of risk. Unfortunately, some people die as a result of receiving anesthesia. If you have certain risk factors, such as being very young, being very elderly, being very sick, or having several health conditions that complicate how you might tolerate a surgical procedure, you should have a comprehensive meeting with your doctor before surgery. Thanks for watching. Please subscribe and return often to get more valuable health information. Until next time, be safe, be well, and be prosperous.